So how do we strike the balance? How do we make the difference? Because somebody might be having a hospital, like one of the hospitals that I know, and maybe the girls that are home, they don't have what to do, they don't have anything to do. They just go there, they take some training, and automatically they become. Is that the training you are talking about, or classify the trainings?
Okay. So in Cameroon, when it comes to training of nurses, we have two main categories. So we have nurses that are being trained by the Ministry of Higher Education, and we have nurses that are also being trained by the Ministry of Public Health. So those under the Ministry of Public Health, we refer to them as the state registered nurses. And then that for the higher education trains more of HND nurses, BSc nurses, masters, and why not right up to PhD levels. So when it comes to training, it actually depends on the category of training a person or a student is receiving, or type of training that one is looking forward in the society. So government has actually offered quality training, government have offered schools, government have authorized some private nursing schools to operate, and all this is based on a curriculum, and I believe the curriculum has enough capacity to be able to train nurses well.
All right, thank you. Okay, you want to add?
Yeah, nurses, like in Cameroon, I always talk based on our setting. Nurses are in different levels. We have nursing assistants, we have bachelor degree nurses, we have up to the, but bachelor is the one recognized everywhere. We also have up to the level of PhD. So it's just a category of nursing. That is why he mentioned something that professional care. We are giving professional care. So you asked a question that, can somebody just wake up from the house and be trained as a nurse? That is where these different levels of nursing come in. We have assistant nurses, so they can as well, those who are passionate enough to give care, they can as well wake up and give care something.
All right, thank you very much for that explanation. And the fact that we have nurses, you say right up to PhD, right?
Yeah.
Because at first people thought that those who are nurses are those who maybe they have written, they wrote the GCE about 10 times and they failed and they have no other future, nothing, and the last option was to be a nurse. But you see that they are changing the narratives nowadays. Okay, thank you so much. I want us to continue again with the discussion. Looking at the team, nurses make the difference. That's our topic for today. I just want you to throw a bit of light to that topic.
All right. Nurses, I would say nurses make a great difference in the field. Like I said earlier, nurses are the ones in the forefront of the well-being of the society. And of course, it is no news today that nurses are the backbones of the hospital. Nurses are not just the backbones of the hospital if they don't make a difference. Our nurses today, many people give throw comments about nursing. Nursing is just a common field. Nursing is where every kind of Jack and G find themselves into. But we are coming here to say, let us make a difference so people will have a different perspective about nursing. Now, nurses make a difference in the fact that they give autonomous care in the field. They give care to everybody. They are not biased with their care, and also nurses have diversified abilities. Nurses are so many things in one. So I would really say us nurses, to make a change and to make the difference, as our theme says, to make the difference today, is for us to engage all of these activities, or all of these activities that will make us have a change in the field, and also change people's perception and knowledge about nursing, or about us nurses, since we are the new generation of nurses.
Okay, can we know some of the things that people are, maybe the nurses are called upon to do to make that difference, to change the perception of people?
Okay, just before I come to that, right now we see that we have two different generations right now. So this new era that we are right now is the era where the nurses that have been trained this time around, they have so much knowledge and everything compared to the nurses before, like probably 10 years ago and all the rest. So there is really an advancement in knowledge. So the kind of knowledge that we receive now in school is not the kind of knowledge that predecessors received back then. So we are being taught the science of nursing, we are being taught the act of nursing, and whatever procedures we do, we know why we are doing it, and whatever, let's say for example, giving medications, we know why we give the medications, we know the side effects, contraindications, and all the rest. So we have the science behind it, we know the knowledge, so the knowledge is what makes the difference between of the nursing of today and the previous nursing. Now, many people still have that misconception that nurses are, that job for losers, nurses are just job for women and all the like. But nowadays, you see, like I, for example, I'm a nurse, soon to become one in a few months. Of course, so I'm also in the nursing field, and our lecturers and other personalities have helped us broaden our minds about the nursing. Nursing is so vast. It's not only about you going to school and then working in a hospital. There's a whole lot of opportunities concerning nursing. There's a whole lot of specialties concerning nursing. So that's what makes the difference between the nursing now and the nursing of the past.
Okay, thank you. I think that is clearly understood. Okay, we continue with the discussion. I want to know, you people are still in school. I don't know. I feel a type about this question, but I believe that you people are still in school and they have been teaching you a lot of things. There's this aspect I wish to find out. In the field, I know you are still in school, but in the field, they must have taught you. If you are in the field, maybe in a hospital and all of that, do you think nurses are being given the chance, the opportunity, their place? I should put it. Are they given their place in the hospitals? Because when it comes to administration, most of the times you find the doctors are the ones at the administration level and all of that. Are nurses given their places in the hospital in terms of administration, or they are just there to receive patients and maybe follow the instruction, give medications?
Okay, madam. I believe nurses are being given their place in the hospital, probably in some areas, but maybe we can have some areas or some locations in Cameroon that maybe that might not really be fluent, but that would be based on something that I will still come about it later. So we have lecturers like Madam Malaika, or Dr. Malaika, and we have, she's a nurse and she's the general supervisor of the regional hospital Boya. We also have Dr. Namundo Sarah, who is also the GS of the regional hospital Limbe. So I also believe, and we also have our HOD, who he is a professor, an associate professor, and he also do nursing. So not only the PhD, even being as a nurse, you can also go to having or to be a professor in nursing. So it's still very, very possible to achieve that educational level, to achieve that educational height. So coming to make the difference is the knowledge. Is the knowledge. So we find ourselves in an environment where we have the previous generation still in the working force, and we have the new generation still coming up. So there is a clash, let me put it that way. So there's still a clash, the balance still needs to be struck, because the old generations have the previous knowledge, which when employed with the new knowledges that we have and new strategies, new technologies, which they are not really being, or they are not able to comprehend those things. So at the end, they still practice the old ways of doing nursing. So at times when you are bringing in these new modalities, these new practices, so at times it might appear as if it is a clash. So I think that's one of the main things that is actually disturbing Cameroon, is that we have these two sets or these two generations of nurses that still needs, I believe, we still need time for that to be adjusted or before things will advance.
All right. Like if I understood well, like the old generation nurses maybe they are not knowledgeable enough, or maybe they are not updated with what people are being taught now. Exactly. So when you go, there's always that clash in the two of you. So how do you think in school with something like this, how is it going to be solved? Because we cannot just decide, or the government cannot just decide and say the old generation nurses should leave the profession so that the new generation nurses come with their new technology and whatsoever.
Exactly. Yeah. So that is why in school, like we are still students in school, so our lecturers, which are one of the best lecturers that we have, the Faculty of Health Science, they always tell us that truly what we teach in class is definitely not what is being practiced in the field. And they told us that you people are to make the difference, that we are making the difference. This generation is to make the difference. So when you go to the hospitals, you practice what you have learned. I don't practice what they are teaching you from the hospital, because we have been taught the correct procedures, we have been taught the correct things to do, and they have told us that when we have been given that opportunity to practice the nursing that we know, we should practice it the correct way. And that makes a difference. So I think that alone is going to start with this generation doing the right thing and not copying what the old generation is doing.
And also it is said that learning never ends. The nurses in the field also have to take it upon themselves to want to create this change. Actually, in creating the change, they will try also to learn new skills from the new or incoming nurses in the field. So try to learn these skills will make a very great change in the nursing field and nursing as a profession.
Okay, there's this thing, they said nurses, they are very compassionate, they are very welcoming, and it is, I don't know, if you want to really do a research, you see that this old generation nurses, some of them are really that compassionate, they are really that caring, they carry out their motherly what love, care to everybody that they meet. Do you think that this new generation, they call them the Android generation, you've gone to school, you have the degree, do you think that they can really take care of patients the way this old generation, I don't know, I got it from you, people are calling them old generation. Do you think that people can do same? I'm not saying that copying what they are doing, but the compassionate aspect of it.
All right, Ma, I'll answer you by saying that nursing is not only a profession, but it is a calling. So if you are being called to be a nurse, I believe that compassion will always be there, whether you are from the old generation or the new generation. Exactly. So compassion is something is a personality. It's not really something that is practiced by a set of people. No, compassion is a personality trait. Compassion is just a personality. It's something inborn. So if you are born to practice to show care or to be compassionate to others, you always be compassionate. It doesn't matter the generation where you're coming from, or it doesn't matter where you're coming from. So that's just it.
Okay, I want us to look at some sacrifices that nurses make, because they really do make a lot of sacrifices. And after which we are going to listen to a report that we did yesterday at High TV about the Nurses Week. So I want us to look at something that is extraordinary, because in that report, when I was doing my research, I heard that they carry out some heartbreaking task in the hospital and all of that. So you people are in school, I know you learn, but what are some of those things that maybe if you're in the hospital, I know since you're in your final year, it means you have done practicals in hospitals. What are those times that you saw something, though you attended to a patient, or you carry out an activity that you are like, am I really making the right choice?
All right. Firstly, I will talk about the extensively long hours of working in the nursing field. Now, nurses have a lot of time to work, and the workload is not something small. They are being packed with work in such a way that it might cause them to not be effective or maybe be arrogant to patients. Now, nurses work for extensively long hours, like I said. So with our system today, we have just a 2-shift system. Some work during the day and some take over at night. Now with, for example, at the regional hospital, there are like so many patients in a particular unit, and you see just 2 or 3 nurses taking care of those patients. So they can never be effective. Or even if they want to be effective as much as possible, that will bring a whole lot of burden and may lead to burnout for the nurses. Also, we have the case of nursing shortage. Nursing shortage, most of the times, nurses rely on nursing students always in the field. They have work, yes, but if nursing students are not in the field, you see they have a lot of burden with work in the field. So I think they really have to advocate for to employ many more nurses in the field, so the work can be effective and it can reduce the burden on nurses.
Okay, let me come to you, Justice. What's that thing that you like, this nursing work like this, I don't know if I'll be able to cope?
Okay, madam. Just adding to what my colleague said, if we're comparing, let's say comparing the nursing abroad, they have this one patient to one nurse relation, but here in Cameroon you can have like one nurse to 10 patient relation. So it makes practice very, very difficult, and it makes things very difficult. So for me personally, I've had my experience in the ICU. So ICU is the ward in the hospital that we take care of critically ill patients, very critically ill, and those kind of patients need close follow-ups. So you have patients with traumatic brain injuries, you have patients with cardiac failure or diseases that put patients in very, very severe conditions. So you find that these patients, you need to monitor them every 30 minutes. Like in the night, you don't sleep. If you sleep, your patient will die. You monitor the vital signs, you check the BPs, you check the heart pressures, you check the blood pressures, you check the pulse, you check their temperatures, their medications that they are supposed to take. So at times it's very stressful. Imagine you work from morning till evening, and you're just up and down, and the workload is so much. At the end, you have burnout. At the end, you are tired, and at the end, it's like, is this profession really for me? Because there's so much work, and at times, maybe if you look at the pay in some areas or health sectors, look at the pay is also very discouraging. Like, I'm working so many hours, or I'm giving in so much of my energy, but at the end I'm receiving nothing. Okay, so I have financial stressors, also have stressors that disposes nurses to burnout, to stress, and all the like. So, and that alone brings a lot of risks to their mental health. So, well, for now, I've come to an understanding about what nursing is all about. I have a very broad knowledge about what nursing is all about. So, and that is what we actually tell our junior ones when they come into level 100, 200. In FHS, let me just take for a scenario. Because we write a concours to get into the nursing department in Faculty of Health Science. So, normally the scenario is that people write the medicine concours and write the nursing concours. So if it happens that they didn't succeed in the nursing concours, and it happens that they succeeded in the nursing concours, that's why they are there. So at the beginning, they are not there because they actually love nursing, but even though some people are there because they actually choose to do nursing, some people are there because nursing was just an option for them. Like, personally, I would testify that nursing at level 1 was just an option for me because I didn't succeed in medicine. And so I'm like, be a nurse. Nurses are everywhere. This and that, like, wow. So it really discouraged me, but when I entered the faculties, we have our lecturers that make us understand, that open up our minds to see the possibilities about nursing. So nursing is just not only about, like what my colleagues said, the bedside nursing. It goes beyond. You can be a teacher, and you can also specialize. At the master's level, we are specializing in the various fields. Almost all the fields that doctors specialize in, nurses can also specialize in that.
Okay.
Why not the PhD level? Why not the professor level? So we can go to any extent that we want. And so when I reached level 2, my narratives about nursing changed, my perspective about nursing changed, my view about nursing changed. And I get to realize that nursing is not only about knowledge, it's also your capability to also apply the knowledge. Because we have some people, and that is also one little discrepancies among nurses, that we have a certain population of people that might not necessarily don't have the knowledge, but can do the practical work. And we have the people that have the knowledge, but they cannot do the practical work. But perfect nursing encompasses what? The knowledge. You have the knowledge, and you are able to do the practice. So that makes the perfect nursing.
Okay, that perfect nursing. Perfect nursing. You have the knowledge, and you can also do the practical work. All right, thank you. We are still going to be discussing a lot of things. We are going to be looking at this, the nursing week. What the Institute of Health Sciences UB. We are going to be looking at the activities. We're also going to be looking at the challenges nurses face and also the myth behind the profession. But right now we are going to go back into the machines and take a report on the Nurses Week.
Every May 6 to May 12 is often celebrated as National Nurses Week.
The world is called upon to honor the incredible nurses who embody the spirit of compassion and care in every healthcare setting. The 2024 theme is Nurses Make the Difference. Throughout the week, healthcare organizations celebrate their teams, and some are even seen featuring on the news and other TV and radio programs. Nurses are essential members of Cameroon's healthcare workforce who provide care at honorable moment. Nurses Week offers the chance to highlight and celebrate nurses for all they do. This year, the theme is accompanied by a campaign. Nurses light up the sky. Nurses perform some of the most difficult and heartbreaking tasks in the medical world. It is time to honor them for their contribution. You're welcome back, televiewers. If you're just tuning in, the program you're watching is Inside the Health on High Television, and we are talking about nurses since we are in the Nurses Week. And in that report, you just heard the sacrifice, what they go through, the contribution they play, whatever they do. These are people that you cannot do without them. The society cannot do without them, and it's time for everybody to get up and give a shout out to all of them and give a tap on their back for what they are doing. You will bear with me that when you go to the hospital, when you are sick whatsoever, the first person that you meet, the first person that talks to you, the first person that welcomes you, that even makes the pain to go away is a nurse. So we really need to give them a tap on their back. And with me here, I'm in the studio with the final year students of the Faculty of Health Sciences, University of Buea. They are here to talk about the Nurses Week. We are in the week. I want to find out some of the activities that are taking place this week.
Okay, madam. So this week, FHS, Faculty of Health Sciences, Department of Nursing, so we have organized a series of activities that is going to take us through this week. So yesterday we had a wonderful workshop on first aid, and we were able to have sister universities, RIMS and Gracious University, that they attended the workshop, and we had a very beautiful lessons pertaining to how to administer first aid from one of our very, very good lecturers from school. And that was so intriguing and was so wonderful experience that people get to learn. And so today, which also constitutes part of the Nurses Week that we're celebrating, as we're also having this program, we're also having a football match that will be going on between FHS and some other sister universities that are coming on. And then on Friday, tomorrow, we have a grand conference, like the team that we have, Nurses Making the Difference. So we have a grand conference tomorrow. I think the conference is going to crown everything tomorrow. So that's a program for FHS as we pertain to celebrate Nurses Week.
So how are you enjoying the week?
Well, the week is so overwhelming. Seeing nurses happy, smiling, just coming together to celebrate is a wonderful thing. And also the workshops organized by Faculty of Health Sciences make the difference. So we started by making a difference by calling for students to attend this workshop. So this workshop actually created impact in the nursing students and other nurses all around. So I'm really enjoying the week and all the activities.
There was one time I had a program here with a nurse. That one is already working, and Itu is from your school. He talked about that there are so many nurses in Cameroon, and every day schools are nursing schools every year and there. They are graduating hundreds and thousands of them. But now we have the government just take a handful, and the rest of them are out there. That challenge is there when it comes to job opportunity for nurses. So, and also there are associations that most of these nurses are not aware of. Meanwhile, if you belong to that association, it's going to help you as a nurse. Are you people aware that there are associations? Are you people aware of making plans since you are still in school that before you graduate, you don't join the rest of the other nurses that have graduated and maybe they don't have a job, they don't have anywhere to fit in and all of that?
All right, with the nursing field, obviously there are so many nursing schools, and there are so many nurses. We thank the private sector for bringing out clinics and other healthcare facilities too. So some of these nurses actually fit into that, because with healthcare, people get sick every day, so we cannot deny that fact. Now, with a particular nursing body, there's no particular nursing body per se. There is a nursing and midwifery body for nurses, not only for nurses, for both nurses and midwives. So there's no grant body for nurses especially.
Okay.
Yes, so there's no grant body for nurses. So, but us as University of Buea students, there are many people trying to do this to like bring out a whole nursing body, to bring out an organization meant only for nurses. But so we can easily fit into these organizations. Fitting into the organizations made from nurses and midwives does not really create an impact, or does not really give us a link with other nurses out there or in the world. So we are still trying to work on that.
What do you have to say about that?
Okay, yeah, looking at that is really a call for concern. Like, you are looking, there's so many schools, there's so many nurses. Look at the university, in a year can graduate like 5,000 nurses. So imagine number of universities graduating this number of nurses. So there's one thing our lecturers make us understand, is that this is a job market. There's no health center or there's no hospital that will want to employ a nurse that is not skilled, will not employ a nurse that is not knowledgeable. So what makes the difference is that you have the knowledge and you're also very skillful at what you do. And so that alone makes the difference. So we realize that we have so many nurses in the society right now, but they don't have the skills to practice the nursing. Like majority, like 70% of most students out here. Now, when you look at the government sector of nursing, they take directly from the science background, because there are criteria, like taking FHS, for example. When writing the concours, you must actually come up from a science background, and they have their reasons why they do so. Come up from a science background, but you realize that many other private universities, they take from any other background, be it the arts background or be it the science background. And from my research, I came to notice that many of these institutes, they call it university institutes, because they should be mentored by a government university or a state university. So many of these now tend to carry out or tend to have courses that will involve science, science subjects that were taught in upper seats or even from Form 5. So at the end, you realize that many people going for HND, they have so many courses at their level 1. Like, you see students doing 15 to 17 courses in level 1. In level 2, they're doing 12 to 15 courses in level 2. And that alone, even though it's already burdensome on them, but I'm seeing that is a way that government is using to bridge up the knowledge gap, so that people from the diverse backgrounds that is not directly from science will be able to catch up within the nursing practice and field. So I believe, and I'm very confident, from what our lecturers have taught us and opened our minds to see the future nursing, is that what do you have to bring at the table? What do you have to show? Yes, because I believe if I'm an employee, if I'm an employer, and I'm to employ someone to work in my company or in my health area, obviously I cannot employ an incompetent person.
Exactly.
I'll employ somebody that knows the work and someone that knows how to do the work. I think that is a little difference that makes it as of the nursing now. So I have majority that are out there, but they cannot really do the work, and we have just the very few that can really do the work.
And has the knowledge as well.
You mentioned something about the pay, just passively. I want us to look at, now you people are students, you people are going to school. The nurses, it's a fact, their salary is not much.
Yeah.
Some of them, they earn very little, especially in the private sector. Your minds, if you were given an opportunity to better the situation of nurses in Cameroon, what are you going to do?
Well, if I'm being given that opportunity, what I will do firstly is like help the nurses meet up to the standard of care, because you don't expect an employer to pay somebody higher than what the person is doing. So if a nurse is in the field and does not deliver what the employer actually wants, so the pay too will actually be small. So what nurses are being, people perceive nursing as a field for uneducated people or people who just find their way in, yes, into
Exactly.
nursing. That is why they tend to give any kind of thing to the nurses as pay or as salary.
That's
So
true,
now,
sir.
if we have the knowledge, I believe that knowledge makes the difference. If we have the knowledge and we can actually show to the employers that we have the knowledge to carry out what or to deliver the job very well or perfectly well, the pay will obviously be higher. Yeah, and I also call for these private sectors, because it's mostly at the private sector that they really bring down the salary of nurses or the seen nurses as just people just to
Assistance.
give a little assistance. So if nurses decide to take up the mantle on themselves to study and top up their level of care, I think there will be a difference. That's what I think. I think there will be a difference in the field. Employers will also see and realize that what this person delivers versus what he or she is paid is not balanced. So they'll try to create a balance.
You don't agree with that theory?
I do agree. And looking from another point of view, you see that the health sector is a business too. So everybody is trying to profit. So everybody is trying to cut down on costs to maximize profit. So that's why at one point you see all these discrepancies that we are seeing. And so I think the way forward is that if we have the right persons in power that are willing and passionate about nursing, I believe they're going to make the right changes in the policies. They're going to make the right changes in whatever jurisdiction that warrants their working. So I believe that the authorities have a lot to play, and that's why we celebrate Nurses Week, because we need to emphasize that we are important. We need to show that nurses are important. We need to change the perceptions about nursing. I will need them to look nurses at a different point of view or at a different perspectives. So I think if those people are both start looking at that and start acknowledging the works of nurses, start acknowledging the importance of nurses, I think it's going to make a difference.
And also, because you people also complain of the long period of work, but they can also reduce the time. And it's not 2 shifts; they can even make it 3 shifts.
Exactly.
All of that. I think those are the. You might think that you are just talking, but they are watching, and they might pick 1 or 2 things that you are saying, and also like one of their resolutions that they are going to look into.
Yes,
And also concerning this issue of pay, the pay in the country, if, like he said, if the authorities step into this, it will make a great difference. Because there might be a standard for other jobs. I think there's a standard pay for other jobs, but nurses, with the nursing career, there's no standard pay. You can get into any clinic and you're being proposed 20,000, as little as that, for a whole month. So if there's a standard policy, I think it will make a great difference in the health system.
All right. In as much as we know that nurses are, they are very important in our society, they play a great role and all of that, the society, in short, it's not just that the society, a lot of these nurses have left a mark in the minds of so many people when they go to the hospital. There are people that when they want to talk about nurses here, they will talk until they cry because of the experience they had with those nurses. That nurses are rude, they are careless. People have lost their life also because of nurses.
Exactly.
This aspect of nurses being rude, what do you have to say about it?
Okay, I will start by saying that when a patient or a patient carer comes into the hospital, now they are at a state of vulnerability. The patient carer especially is very vulnerable to violence, to any sort of attack. So when they see their patients in a critically ill situation and there are other patients, they expect that the nurses should focus their attention on that particular patient, which is not bad. It is okay for them to be vulnerable. Now, with this point, there are so many other patients. Let's just imagine that there are many critical patients in the field. So a particular patient carer sees that they are attending to this particular patient, but you want your patient to be attended to, even if your patient is not in a more critical state than the other person the nurse is attending to. So with all of this, it creates a form of tension and frustration in the minds of the patient carers. So it turns out that they want to pour all their frustration on the nurses, because since the nurses are the forefront of the hospital, they tend to pour all their frustration on the nurses. So with these nurses now, they cannot take it. Some of the nurses cannot take it actually. They tend to like retaliate, they act out. This is what is bringing in workplace violence. There's a lot of workplace violence. You hear nurses shouting here and there with patient carers or some patients. Some patient carers are very, I would say, they don't take it. They are impatient. And also with the nurses being rude, we say nursing is a calling and also a personality. If you are somebody who is naturally rude, I think they will retaliate in a rude way to others who have been in the field and know what nursing is all about, and also knows how patients and the patients react, and also patient carers. They know how they are frustrated when they find when they are in such a situation. They will at least become, I think so. They will become, yes.
But there are situations where the patient carer, they are not rude, they are just being careless, they are just being good. There are situations I myself have seen that there are good nurses in the field. So you people have to talk to them.
Yes, madam. Definitely you are right. I personally have experienced that in the hospital. That's the truth. You have some that are good, you have some that are very rude. And I don't know, but that's the reality. That's what is happening. At times, it could be that these nurses pass through a lot. They have a lot of stressors. There are a lot of stressors that nurses pass through. And not just from work, maybe it could be from home. And there's a lot of challenges that these nurses pass through. So at times, they might tend to pour out the frustrations on the patients. And at times, they might react in a very bad manner or in a very bad behavior towards the patient carers or towards the patient. Now, when you look at this kind of a scenario, ideally, stemming off from a mother of nursing, Florence Nightingale, violence is not part of nursing. Like communication skills is one of the most important aspects when it comes to nursing. How you communicate with your patient, how you communicate among yourselves, and how you communicate among other health personnel. So communication, so I think can still fall back to communication, because we ought not to, maybe it could be the way the nurse approach the patient or the caregiver, and that's how you also reacted. Or maybe the nurse lack the communication skills to also approach. And also, nurses are being called upon to exercise patience. Nurses are also being called upon to show empathy. Empathy is like you are in the patient's shoes, like how you feeling for the patient, and like if you are the one, how will you feel, and you are going to react. Normally, there's some patients that they might be violent due to maybe their present disease condition, or maybe due to the scenario in which they found themselves at that moment. So it might not necessarily be intentional, but you as a nurse with a compassionate heart, you need to show empathy, you need to reason with the patient, and you need to identify. That's why, like they say, nursing is a continuous assessment. You assess you assess problems, and you bring out nursing diagnosis, and you try to resolve them. So I think, well, I don't know how we can go about that, but I believe it just comes to understanding. We need to have empathy for those people, and we need to have the knowledge, we need to exercise patience, and I think that will do.
All right. And also to all the nurses out there, let us also be aware that patients should always be in front, no matter what. Let us put patients in front. They are the people we care for. They are always vulnerable at all times. So let us put patients in front.
All right, thank you. And I must say that there are very good nurses there, because at times you go to the hospital, a particular nurse will attend to you, and they work on shifts. And when that patient is, let me say the night shift is about 3 days, and you see a particular nurse for that 3 days attending to you, to the patient, and when that nurse is about taking the days off and comes and tell the patient that you'll not be seeing me for 1 week, you'll not be seeing me for 3, you see the patient really downcasted and everything.
Exactly.
You know, there are some that are really called to do what they are doing.
Exactly.
They are compassionate, they are there, they even help the patient to heal.
Exactly.
Because a nurse too can make a patient heal, recover fast,
Exactly.
and also to make the patient to instead get worse.
Exactly.
So it's important. I know that nurses are very important personalities in our society. I love nurses. It's high time everybody start appreciating what they are doing.
Indeed.
They are doing a great job, because really they are doing a great job. Anyways, even at home, when you are at home and you have a nurse beside you, you have fever, the next thing you run to the door, I have fever, I have this, do you have that? So they are very important people in the society. We should use this week to celebrate them. All right, you people are about, you mentioned here that in a few months you are going to become a full professional nurse and
Yes,
practice.
madam.
Your Faculty of Health Science, University of Buea, do you think that they have equipped you people enough in such a way that when you go now to the field, you will not face any challenge when it comes to applying your professional skills?
Yeah, I personally, I think they have done more than enough. Just looking at the curriculum itself, it can actually speak for itself. The curriculum have been designed in such a way that it impacts students with the knowledge, and it gives them quality time and quantity time to be able to practice that knowledge. So like in FHS, the first 3 years is theory, the last year is practicals, and then followed by defense. So we have at least 1 year experience in the practical field, and not just here in Buea. So I've been to Limbe, I've been to Douala, I've been to Yaoundé, to be able to learn and also practice what we have learned. And I think that alone have actually equipped us well for the coming.
Yeah.
Are you ready? No, speak for yourself. Let us also speak for ourselves.
Yeah, for me, I'm ready,
Okay.
very much ready.
Let me hear from
The
you.
fact that FHS writes a concours, meaning it means they select the best from the best.
Exactly.
So they don't take any kind of person into the field. So FHS, I'll really give a hail to FHS nurses, because everybody has in his or her subconscious that I am from FHS, I need to make a difference. Each and every one of us as a person strives to make a difference, because in the field they look up to us. We are the, like we say, we are the nurses of the day in the hospital. So almost everybody, the nurses in the hospital look up to us, the final year, or not only final year, FHS nurses per se. So whenever we are in the field, everybody say, oh, FHS nurses are here, therefore they can do the job. So they sometimes they seem to allow us to do everything, because they know that
so
we
much
can
from
actually
us.
deliver. Yeah, so they speak
so much
so
from
highly
us.
of FHS nurses. Not only that they speak so highly, we actually deliver.
Alright.
Yes, I can say FHS nurses are good.
Okay, we are celebrating the day, the main day itself is Friday, is tomorrow, right?
Yes,
It's tomorrow.
in FHS.
So what should the population of Buea be expecting on this day?
Okay, so tomorrow we are going to have a conference about our team, nurses making the difference, and we are going to have some of our lecturers, and we are going to have some of our professors teaching us. They'll be there and are going to talk that day. And that day is also be filled with extracurricular activities to also make that day very entertaining. And of course, there'll be item 11 at the end of that day. So, so you're also invited. You are invited to FHS. So the conference is going to take place at Amphi 500 in FHS main campus at May 17, slightly after May 17. So you are also invited if you want to attend the conference. I bet you it's going to be very enriching, and you are going to love it, and you won't regret your time if you spend it with us.
Okay. Do you have
And mind you that the conference is not only for nursing students. No, the conference is for everybody. Everyone willing to attend this conference is very open for everybody. So feel free as a nurse or no nurse to attend this conference. It is very enriching, as he said.
Okay. We are almost rounding up this program for today, but I cannot go without I'm looking at making the difference here. Okay. If you are, let's assume you are not assuming it's going to eventually happen. If you happen to start working today, what is that difference that you are going to be making where you are working?
To get well as patients. When they come to the hospital, they actually want to get well. So what I'll give to them is my compassionate heart as a nurse.
Wow.
I'll give them so much love and compassion. And I also make a difference by making them feel so welcoming in the hospital and think the hospital is their house.
All right, thank you. What's that difference you're going to make?
Wow, the difference I'm going to make, I really thank God that right now, or in our current time, we have at least even the small fraction of people that we have in the various health centers, in the various hospitals, they are already setting the pace. And that alone is already an encouragement to us.
Exactly.
An encouragement to me particularly to also follow in that trend and also do better. Nursing now is evolving. Like we said, learning never ends. We gain knowledge every day. We do research, and we gain knowledge, we discover, and we see how we can improve the knowledge. So through research, through technology, so it's coming, even though it still has a long way to reach Africa and Cameroon in general, but the nearest future, we have technology is changing, knowledge is also changing with respect to research and all that. So I believe that following the current trend, that are trying to bring that change, and also why not develop strategies maybe in a later future that can further improve the practice of nursing and the well-being of nurses in general.
All right, thank you. Thank you, televiewers. I believe that we've learned a lot. We know who a nurse is, and we know that they are very important persons. They are making the difference in the society, and they plan to make more differences in the society in the health domain. They play a great role, as we've heard it,